Diagnosis through. Let's discuss diagnosis through the eyes, the 8 zones. According to the inner canon of the Yellow Emperor, the essence of the 5 zang and 6 fu organs all ascend to the eyes, which can reveal the health status of the zang fu organs. This is indicative of the close relationship of the eyes with the zang fu organs, muscle and bone meridians, spirit and qi, and blood. The reason the eyes can see everything in differentiate colors is that they are nourished by the essence of the zang and fu organs. The disharmony of the zang fu organs and meridians and collaterals are often reflected in the eyes, even leading to some eye diseases. Conversely, eye diseases can also affect the connected internal organs through meridians and collaterals, even causing a general malaise throughout the body. By observing the eyes, we can not only diagnose eye diseases, but also changes in the internal organs, thereby arriving at general diagnosis of other diseases. Given the close relationship of the eyes with the 5 zang organs and based on the relationship between the eyes and the meridians, the eyes are divided into different parts with regards to the related meridians to show how a particular part of the eye reflects a certain internal organ. Looking straight ahead, draw an imaginary straight line connecting the centers of the pupil and then extend it through the medial and lateral canthi. Then draw another straight line vertically through the centers of the pupil and extend it beyond the upper and lower eye sockets. In this way, the eye is divided into 4 parts. Then divide each part further into 2 equal zones, that is 4 quarters and 8 identical areas. These 8 identical areas are the 8 zones, each corresponding to a specific internal organ. Here is the illustration of the distribution of corresponding zang fu organs in the eyes. Number 1 pertains to the lung and the large intestine, 2 to the kidneys and bladder. Number 3, the upper burner. This includes everything above the diaphragm, the thorax, the back, the internal organs in the chest cavity, the neck, head and face, and the 5 sense organs and the upper limbs. Number 4 pertains to the liver and gallbladder. Number 5, the middle burner. This includes everything below the diaphragm and above the belly button, the upper abdomen, the lower back, and all the internal organs. Number 6 pertains to the heart and small intestines. Number 7, the spleen and stomach. Number 8, the lower burner. This pertains to the organs below the level of the belly button, the lower abdomen, the sacrum, the ilium, the hips, the pelvis, the reproductive and urinary systems, and the lower limbs. Now let's go to the color of the eyes. Changes in the color of the eyes are reflective of a person's state of health. By inspecting the color of both eyes and blood streaks in the eyes, a doctor can determine whether there are pathogenic developments with the connected organs. The parts of the eye that are easier to observe include the white of the eye and the iris, or the black. A clean bluish white is considered normal in color of the white. If abnormalities occur in the white, example, the color turns red, yellow, or has some color spots, this signals problem with your health. If there is a black spot on the iris, you should pay attention to it. Thank you for your attention.
Let us go to interviewing. The topic is pain. When inquiring about pain, it is important to locate where exactly the pain is experienced. This is to get an idea of which channels or which organs may be involved. For example, it is important when diagnosing joint pain to identify which channel is imbalanced. It is also important to investigate other aspects of the painful sensation, such as the quality of the pain, what improves or triggers the pain, how and when it arose, if the joint feels hot, whether there is swelling, and so on. This is because the individual characteristics will help to differentiate one type of pain from another. In general, all pain is due to a stagnation of qi. Butong zitong tong zi butong means when there is a stagnation, there is pain. Where there is free movement, there is no pain. A stagnation of qi can arise when there is an excess condition and in deficiency conditions. Sorry. In a deficient condition, there will not be enough qi or blood to circulate qi, blood, or jinye. The pain seen in a deficient condition will be milder. It will typically be described as being a dull or nagging pain or a tingling sensation. The pain will be relieved or ameliorated by palpating or putting your hand on the area. This is because the physical pressure will increase the amount of qi in an area that is qi deficient. Deficiency types of pain should, in theory, feel worse after physical activity and improve with rest. Whilst this statement is true, it is also misleading. In some situations, physical activity may well relieve the pain in a deficiency condition. This is because the physical activity will create a circulation of qi, temporarily relieving the stagnation and thereby the pain. Deficiency types of pain can be worse in the morning or if the person has been sitting still for a long time, which is otherwise a characteristic of excess pain. Again, this is because there is too little qi to move the stagnant qi and blood, which stagnate when there is no physical activity. Deficiency types of pain are often worse after exertion or return later in the day when the person is tired. This is seen, for example, in lumbar pain, where the pain is worse if the person has been standing all day. Deficiency pain will usually have arisen gradually. Acute pain, on the other hand, is almost always a manifestation of an excess condition. Excess conditions will often be aggravated by inactivity, especially lying or sitting still for long periods of time, such as when sleeping. Contrary to what is written in standard TCM textbooks, activity does not necessarily relieve the pain. On the contrary, if there is a severe stagnation of qi, blood, and jinye, such as when there is a sprain after a physical trauma or an operation, the movement of the joint will be severely limited, and there will be extreme pain if the joint or muscle is moved beyond this range. Excess pain will typically be aggravated or feel greater if the area is palpated. This is because the increase in physical pressure will increase the amount of qi in an area that already has an excess, something that can therefore seem counterintuitive. It is when people with acute pain, such as a headache, press their fingers against certain spots, for example, the temple, to relieve the tension. If you observe what they are doing, you will often see that they are massaging the spot with very small movements of their fingers. They are therefore not increasing the amount of qi in the area, but spreading it with a draining finger technique and thereby relieving the pain. Because excess pain conditions are aggravated by pressure, the person will often have a dislike of wearing tight clothes in the relevant area. This is seen, for example, in some women with menstrual pain having an aversion to wearing tight jeans up to and during the start of the menstrual bleeding. The descriptions of some of the individual types of pain can sound very similar. This is because the mechanisms involved in the generation of the pain can be fairly similar. Blood stagnation, for example, will manifest with a pain that is stabbing, piercing, and sharp. The pain will be localized to a specific spot and will not move around. Cold can cause pain that is fairly similar to blood stagnation pain. Instead of being piercing and sharp, cold stagnation pain is biting and cramping. The reason that the descriptions of these types of pain are so similar is that cold contracts and thereby blocks the vessels, stagnating blood. When there is cold stagnation, the area will feel either subjectively or objectively cold. Cold pain will be alleviated by heat. One should, however, be careful not to conclude that all pain that is alleviated by heat is cold pain. It is not. Heat is yang and thereby creates movement and activity. This means that most types of stagnation and therefore pain will be relieved by warmth. Pain from blood stagnation is often worse at night. This is because there is less movement of qi in the body whilst the person is sleeping, so blood is not circulated as effectively as during the day when the person is physically active. Furthermore, at night, blood flows back to the liver where it is stored. This means that there is less blood circulating in the channels and vessels, so there will be a greater tendency for blood to stagnate in places where there is already a stagnation. Pain from chi stagnation will often move from place to place within a specific area. The person may not be able to localize the focus of the pain to a specific spot, but will feel the pain in the area. Whereas a patient with cold and blood stagnation will often point to a specific spot with their finger. A patient with chi stagnation pain is more likely to show you an area with their whole hand, possibly moving the hand at the same time. There will often be distension or even bloating in the area. The pain itself usually in waves or is variable in its intensity. It can also be described as tension or pressure. Pain caused by wind will also move from place to place, but in this instance, the pain moves not only within a limited area of the body, but also from one area to another. Heat will manifest with a pain that is burning or stinging. Pain caused by heat can be relieved by putting something cold, such as ice, on the area. It can sometimes be relieved by the use of something hot like moxa, because the heat will help stagnate chi, blood, and jinya to circulate. Dampness will result in a pain that is heavy and dull. Thank you so much for your attention.
Let's discuss pattern differentiation, TCM diagnosis. The four methods the patient file relevant information according to TCM. TCM diagnosis relies on four diagnostic methods: observation, listening, smelling, inquiring, and palpation, which gather most of the same information included in the Western clinical file. The four methods also gather information that is not typically included or not given much diagnostic value in the West, but is considered relevant for a correct pattern diagnosis. The most salient example are observation of the tongue and palpation of the radial pulses, which prove a wealth of qualitative information indispensable to TCM pattern identification. Integrating the four diagnostic methods, integrate East and West. It must be emphasized that in the practice of TCM, the physician should never rely on one isolated diagnostic method. Information from all four methods must be integrated into the diagnosis. Moreover, in the modern clinical practice of Chinese medicine, the value of integrating diagnostic procedures, concepts, and theories from Western biomedicine is becoming increasingly important. The clinical record for TCM diagnosis. The table illustrates most important items of diagnostic information gathered during a TCM examination. It is also a proposal of the kind of organization a patient file may contain to allow for both Western biomedical and Chinese pattern discrimination diagnosis. So here we have the table of our clinical record, conventional TCM. The information, patient's personal information, the clinical value or relevance, the same as Western medicine. For the family medical history, same as Western medicine, it evaluates the strength of kidney essence. For the lifestyle history, the clinical value, same as the Western medicine, correlates habits, lifestyle, diet, emotional, and social influence to health. For the personal medical history, the clinical value is same as Western medicine. The present conditions, same as Western medicine. It is the basic information for pattern discrimination. For the organ system, same as Western biomedical body system classification, it corresponds the correspondence with TCM organ system. For the specific TCM information, valuable relevant data for a TCM diagnosis. For the physical examination, same as Western medicine, some information with special value to TCM. For example, point and channel palpation, changes in color, temperature, humidity, tension, rigidity, tenderness, etc. For the examination of channels, regions, and points, only used in TCM diagnosis. For the false diagnosis, only used in TCM diagnosis, relevant to pattern discrimination. Time diagnosis, only used in TCM diagnosis, relevant to pattern discrimination. Analysis of information from Western biomedical and traditional Chinese perspective, including integration of complementary findings of each one. Pattern, exclusive to TCM. For the treatment, integrating TCM and biomedical, integrated and according to the needs of the patient. For the follow-up, same for both system, referral, and consultation, instances requiring specialized diagnosis or treatment beyond the scope of TCM, that is specialized or surgical treatment. For the TCM relevant information, for number 1, the stool and defecation, we have the remarks. We get the frequency, odor, color, consistency, pain, helps to discern pattern of heat, cold, damp, phlegm, deficiency, excess, cheese, stagnation, etc. Number 2, urination. We get the frequency, odor, color, pain, indicates heat, cold, damp patterns. Number 3, the sweat. The remark is for the presence or absence, amount, time of day when it occurs, subjective sensation of cold or heat, consistency, relation to activity, indicates Qi and Yin deficiency, cold and heat pattern. Number 4, thirst. The remark is the presence or absence of preference for hot or cold drinks, especially indicate for heat patterns. Number 5, spleen pattern. This is for the disturbances, dreams, insomnia, indicates heart, liver, and kidney, heart, or spleen heart patterns. Number 6, menstruation, frequency, duration. We get the frequency, duration, color, amount, and consistency of blood, clots, pain, indicates deficiency, excess, heat, or cold, Qi, and blood stagnation patterns. For the emotion, number 7, the TCM recognizes 7 emotions: the anger, euphoria, worry, sadness, grief, fear, and pride. The presence, prevalence of any one of which is seen as a marker of illness, especially indicative of heart and liver pattern. Number 8, the diet. We get the regularity and number of meals per day, amount, specific food eaten. Indicative of food stagnation, indigestion, spleen, stomach, or damp. We get the frequency, correlation to patient age, indicator of condition of kidney essence. Number 10, exercise. We get the relevant in relation to strengthening the vital energy. Excess can be linked to spleen and or kidney damage. Number 11, pulse palpation, indicator for the condition of Qi and blood in the organ channel system, fundamental for TCM pattern discrimination. Number 12, tongue observation, indicator of the condition of the internal organs and nature of diseases, fundamental for TCM pattern discrimination. Number 13, the pain. We get the nature, the quality of pain, location, regional, and channel organ distribution. This indicates cold, heat, damp, Qi, and blood stagnation pattern, useful for pattern discrimination and treatment. Number 14, channel observation, palpation. We get the presence and location of lesions, discoloration, lumps, nodules, abscesses, scars. Correlates to the channel organ system, useful for pattern discrimination and treatment. Thank you for your attention.
We now go to differential diagnosis for both Western and Chinese medicine. Asthma, breathlessness, and wheezing. Western differentiation for asthma, breathlessness, and wheezing. For asthma, there will be episodic attacks of reversible wheezing and breathlessness from bronchospasm, tightness in the chest, wheezing, difficulty breathing, which is worse on expiration, and cough. Extrinsic asthma is usually seen in childhood with family history of allergies, eczema, hay fever, or migraine may also be present. Intrinsic asthma typically seen in adulthood with less emphasis on allergens. For chronic bronchitis, the bronchioles are narrowed and blocked by mucus in lungs. Abundant phlegm, worse in the morning, wheezing more constant than with asthma, can lead to chest infections and emphysema. Emphysema, irreversible overextension of alveoli. Breathlessness without cough or sputum, worse on exertion, leads to limited chest movements and cyanosis. Lung cancer, there is persistent cough, chest pain, blood-tinged sputum, breathlessness, possibly anorexia, and weight loss. For pneumothorax, this is due to air in pleural cavity, collapse of lung in severe cases, sudden chest pain on affected side and breathlessness, possibly pallor, cyanosis, confusion, and rapid pulse. Pleurisy is inflammation of pleura. Sharp pain in the chest felt also in the axilla or around the scapula, worse for coughing, movement, and respiration. Other causes include cystic fibrosis, pulmonary tuberculosis, cardiac asthma, left ventricular failure, and reflux esophagitis. Chinese differentiation for asthma, breathlessness, and wheezing. Diagnostic questioning according to organ differentiation. This will involve the spleen, liver, lung, kidney. So for the spleen, lung, kidney, the Shang cycle. For the spleen, lung, tie-in, liver, lung, co-cycle, insulting relationship. Spleen, kidney, co-cycle. Diagnostic questioning according to phases will include acute, which is wheezing, breathlessness, rapid pulse, and chronic, characterized by a nocturnal cough. Diagnostic questioning according to cough. So we have dry, that's yin deficiency, productive and loose, phlegm, weak, chronic, worse with exertion, at night, when tired, qi deficiency, forceful, loud, paroxysmal, excess. For color and nature of phlegm, watery, white, clear, this is cold, blood-tinged and scant, lung heat, lung dryness, or indeficiency. Yellow, thick, sticky, this means heat. Worse in cold weather signifies cold or yang deficiency. No phlegm, non-diffusion of lung qi, qi stagnation, yin deficiency. Purple block, blood stasis, copious, easily expectorated, dampness. Diagnostic questioning according to etiology, external evil, emotional stress, which includes grief, worry, anger, sorrow, anxiety. For diet, excess sweet, greasy, or dairy food injuring spleen and chronic illness. The Zanfu patterns. For acute, we have wind cold invading the lung, wind cold invading the lung with internal heat, wind heat invading the lung. Chronic excess, phlegm dump obstructing the lung, phlegm heat obstructing the lung, stagnation of liver qi, liver fire insulting the lung. Chronic deficiency, lung qi and yin deficiency, lung and spleen qi deficiency, lung and kidney yin or yang deficiency, liver yin deficiency, kidney failing to receive qi, and kidney and spleen yang deficiency. Thank you for your attention.
Let's proceed to Zhang viscera, the kidney physiological functions, part 3. Start with its function of governing water fluid metabolism. The kidney has the function of controlling and regulating the metabolism of water and body fluids. Hence the saying, the kidney is the water organ. The lung, the spleen, the liver, the kidney, the sanjiao, and other visceral organs are all involved in the metabolism of water and fluids. Under normal conditions, the process cannot be completed without the dispersing and lowering functions of the lung, the transporting and transforming function of the spleen, the conducting and facilitating function of the liver, the water passage dredging function of the sanjiao, as well as the transforming function of the kidney. Of these organs, the kidney has the most important and controlling role, and it requires the transformation function of the kidney yang for expression. Here is a diagram or an illustration of the kidney. The kidney yang governs water fluid metabolism. An impairment of qi in the transformation will lead to an impairment of water metabolism, resulting to edema and polyuria or dysuria. Kidney in the yin opens in the yin orifices, and these dysfunctions here will lead to sexual dysfunction or intestinal dysfunction. In intestinal dysfunction, this will manifest with pre-dawn diarrhea, and sexual dysfunction will manifest with impotence, seminal emission, and premature ejaculation. The kidney's role has three aspects. First, kidney yang is the motive power for water and fluid metabolism. Kidney yang is the root of yang qi of the entire body. Although the lung, the spleen, the liver, and the sanja all participate, it is the warming and evaporating function of the kidney that provides the basic motive power. Second, the kidney sends the clear to the lung for dispersal to the body and the turbid to the bladder as urine to be excreted. This function of raising the clear and lowering the turbid is important for maintaining water balance. Third, the kidney controls the opening and closing of the urinary bladder. The opening the bladder enables it to excrete the stored urine, while closing it enables the body to retain the fluids needed by the organs and tissues. The opening and closing of the bladder depend upon the contracting action of the kidney yin and the transforming action of the kidney yang. If the transforming action of the kidney yang fails, there may appear such symptoms as oliguria or anuria and edema. If the contracting action of the kidney yin fails, there may appear such as symptoms as polyuria, incontinence, or enuresis. Next function is acceptance of qi. The kidney has the function of accepting qi that has been inhaled by the lung. The kidney's acceptance of qi prevents respiration from becoming shallow, thus ensuring normal exchanges of gas between the body and external environment. Although the lung controls respiration, it is the kidney that maintains its regularity. More specifically, the depth, the smoothness, and the evenness of respiratory movement can be maintained only if qi inhaled by the lung has descended into and has been accepted by the kidney. If the kidney's capacity to accept qi is diminished, there may appear shallow respiration, shortness of breath on light exertion, wheezing with prolonged expiration and shortened inspiration, or labored breathing. In clinical practice, chronic bronchitis, pulmonary emphysema, and lung-induced heart disease often show symptoms of the kidney failing to accept qi. This can be treated with good results by method of supporting the kidney to accept qi. The acceptance of qi is one aspect of the storing function of the kidney. Thank you for your attention.
Let us go to diagnosis according to Zhangfu organ patterns. The topic is heart qi deficiency. Heart qi deficiency. This pattern has symptoms and signs that are specific to the heart, such as palpitations, whilst also manifesting general qi deficiency symptoms and signs, such as fatigue. This pattern can be physical or mental emotional, with a person lacking self-esteem, self-confidence, or happiness. There is a close relationship between the heart and lung in their functioning. This means that there will usually be tangible symptoms and signs of lung qi deficiency where there is heart qi deficiency. Heart qi will also be weakened by prolonged or excessive sorrow and melancholy, which also affects the lung negatively because even though these emotions affect the lung directly, Shen and thereby the heart will register and be conscious of these emotions and thereby also be affected by them. When a person experiences sorrow and melancholy, there is also a lack of joy. This means that the heart chi will lack nourishment. Heart chi in general is nourished by joy and love. A person whose life lacks joy, love, and a sense of companionship and belonging will often become heart chi deficient. This can particularly be the case if the person did not experience enough love and attention or if they felt ostracized in childhood. In childhood, the organs are not fully stable and their chi is more volatile. This means that the internal organs can be easily affected by etiological factors such as the 7 emotions. These factors will have a greater effect in childhood than they will in later life and can permanently influence the organ in question. So let us look at its etiology. Blood loss, prolonged illness, physical strain, and emotional imbalances. A lack of joy in life or loneliness can particularly lead to heart chi deficiency. Shock scatters heart chi and thereby weakening it. The heart controls sweating. Excessive sweating can deplete heart chi. The consumption of recreational drugs and some medicines can open the heart and thereby spread heart chi. This can weaken heart chi deficiency over time. The symptoms and signs are palpitations, slight shortness of breath, shallow breathing, pale complexion, mental, physical, and or emotional fatigue, spontaneous sweating, sadness, melancholy, lack of joy, feeling of loneliness, depression, low self-esteem, or lack of self-confidence. The person may seem very quiet, diffident, or shy. Speech impediments such as stammering. The voice may sound flat and lack vitality or tone variation. Lack of sparkle in the eyes. Pale or normal colored tongue. Deep and weak, especially in the left chin position. The pulse may be knotted. The key symptoms are palpitations, fatigue, sadness, lack of self-confidence, and a weak pulse. The treatment principle is to tonify the heart chi. The acupuncture points to be used are heart 5, heart 7, UB15, REN 6, REN 14, REN 15, REN 17, and stomach 36. The needling technique is tonifying and moxa can be used. The explanation for the points is that heart 5, heart 7, REN 14, REN 15, and UB15 tonify heart chi. REN 17 tonifies chi in the upper jaw, and REN 6 and stomach 36 tonify chi. For relevant advice, heart chi is best tonified on the emotional level. It is important that the person cultivates joy in their life. Of course, this is easier said than done. As well as working with their emotions, the person can try to spend some time each day doing something that gives them genuine pleasure, or they can sit and meditate on something that for them is beautiful. Tonifying chi in general will also benefit the patient. This can be done through the diet, access to fresh air, and breathing exercises, as well as getting enough rest and avoiding overexertion. Heart chi can be depleted through excessive sweating. This means that the use of saunas and steam baths is not something that is recommended for these patients. The patient should avoid the use of recreational drugs, medicines, and experiences that spread heart chi. Heart chi deficiency can be caused by the following patterns of imbalance, like spleen chi deficiency, lung chi deficiency, kidney chi deficiency, gallbladder chi deficiency, heart chi stagnation, and blood deficiency. And these are the following patterns of imbalance: is heart yang deficiency, heart chi stagnation, heart yin deficiency, heart blood deficiency, and lung chi deficiency. So as a summary for heart chi deficiency, the etiology is sadness and grief, chronic illness, blood loss, insufficient ancestral chi. The underlying or accompanying pathology is spleen chi deficiency, heart and or liver blood deficiency, kidney chi yang deficiency, wind cold settling in the heart, and static blood obstructing the vessels. The possible presenting conditions are cardiac failure, angina pectoris, arrhythmia, general asthenia, and neurosis. The signs and symptoms are palpitations, shortness of breath, worse on exertion, an oppression in the chest, sweating, pallor, tiredness, and fatigue. The pulse will be empty and the tongue will be normal or pale color and may have a midline crack reaching to the tip. The treatment principle is to boost heart chi and calm the shen. The acupuncture treatment is heart 5 to supplement heart chi, Bladder 15, the backshoe point for the heart. Ren 6, it supplements original chi. Heart 7 quiets the heart and spirit. Pericardium 6 supplements heart chi and calms the shen. Ren 17 is a gathering point for chi. Ren 14 clears the heart and stabilizes the spirit. And stomach 36 regulates chi. Needle with supplementation and moxa. Thank you so much for your attention.
Let's talk about etiology in Chinese medicine. We will focus on dampness. Dampness is a dominant climatic pathogenic factor of late summer. The period of transition from summer to autumn is the wettest season of the year in eastern China. Illnesses of dampness also fall in two broad groups: exogenous and endogenous dampness illnesses. Exogenous dampness illnesses usually result from very damp climate, exposure to rain or water, or a damp residence. Endogenous dampness illnesses arise when the spleen's transforming function is weak, so that dampness accumulates. Although these two types of dampness differ, they often affect each other in the course of illnesses. So here we can see the nature and pathogenic characteristics of dampness. So dampness disturbs the functional chi. So this will result in aversion to cold, fever, sensation of heaviness in the head and body. Dampness evil also injures yang qi. This will cause failure of the spleen in transportation and transformation, leading to diarrhea, scanty urine, edema, and ascites. Dampness evil can cause heaviness and turbidity, and also band-like squeezing headache and numb skin and muscles and arthrodenia. And dampness evil can also lead to stiffness and stagnation. And the patient will be feeling heavy and tired all over the body, sluggish or heavy, turbid urine, liquid stools, vaginal discharge. So this is actually a pathogen that can cause both chemical and physical irritation. And for internal dampness, this is the result of failure of the spleen in transporting and transforming functions. So this is what we call interior dampness. So with interior dampness, there is retention of the interior water dampness in the upper jaw, middle jaw, and in the lower jaw. Dampness is a yin evil and tends to obstruct qi movement and consume yang qi. Dampness is heavy and turbid, and its nature resembles that of water. When it invades the body, it tends to settle in the Zangfu viscera and their meridians, where it readily impedes the movement of qi. This inhibits the free ascent and descent of qi and blocks the meridians, producing such symptoms as chest tightness, gastric distension, scant urine with dysuria, and difficulty with defecation. Because dampness is a yin evil, when it invades the body, it readily injures yang qi. Exogenous dampness often accumulates in the body, and the spleen tends to be the first organ it damages, so that spleen yang cannot be aroused and its transportation and transformation functions ineffective. The stagnated dampness accumulates and can lead to diarrhea, oliguria, edema, and ascites. The dampness evil is heavy and turbid. Heavy means that a patient with an exogenous dampness illness often has a headache that is like the head being bound tightly, heaviness and tiredness in the entire body, and aches and heaviness in the limbs. Turbid generally means that the secretions are not clear. When dampness causes illness, there may be many symptoms of turbidity and contamination, such as a dirty-looking face, cloudy discharge from the eyes, diarrhea with feces containing mucus or bloody pus, cloudy urine, profuse vaginal discharge in women, and weeping eczema. Dampness is glutinous and viscous. These properties are manifested in two ways. First, the fluids of secretions and excreta are viscous. Second, illnesses caused by the dampness evil tend to persist and be difficult to eradicate, and they often recur. Examples include rheumatism and eczema. Dampness tends to move downward and readily attack the insides of the body. It belongs to the water element, and the water element tends to move downward. Thus, illnesses caused by dampness tend to cause symptoms mainly affecting the lower parts of the body. For example, edema is generally more conspicuous in the lower limbs. Also, cloudy urine, vaginal discharge, and mucoid diarrhea are mostly due to the descent of the dampness evil. Thank you very much for your attention.
Let's proceed to the emotions and talk about joy. A normal state of joy is obviously not in itself a cause of disease. On the contrary, it is a beneficial mental state that favors a smooth functioning of the internal organs and the mental faculties. The simple questions in chapter 39 says, joy makes the mind peaceful and relaxed. It benefits the nutritive and defensive chi, and it makes chi relax and slow down. On the other hand, in chapter 2 of the simple question says, the heart controls joy. Joy injures the heart, and fear counteracts joy. Here is a clinical picture of joy. And joy can cause palpitations, overexcitement, insomnia, restlessness, talking a lot. The tongue will have a red tip, and it makes the heart larger. The pulse will be overflowing empty on the left front position. What is meant by joy as a cause of disease is obviously not a state of healthy contentment, but one of excessive excitement and craving that can injure the heart. This happens to people who live in a state of continuous mental stimulation, however pleasurable, or excessive excitement. In other words, a life of hard playing. As indicated earlier, inordinate cravings is an aspect of emotions, joy, and it stirs up the minister fire, which overstimulates the mind. Joy in the broad sense indicated above makes the heart larger. This leads to excessive stimulation of the heart, which in time may lead to heart-related symptoms and signs. This may deviate somewhat from the classic heart patterns. The main manifestations would be palpitations, overexcitability, insomnia, restlessness, talking a lot, and a red tip of the tongue. The pulse would typically be slow, slightly overflowing but empty on the left front position. Here is an illustration of the effects of joy. It can cause excessive stimulation, excessive craving, a sudden joy, and overexcitement. Joy can also slow down qi and result to heart qi deficiency. Joy may also be marked out as a cause of disease when it is sudden. This happens, for example, on hearing good news unexpectedly. In this situation, joy is akin to shock, although the former makes the heart larger and the latter smaller. Fei Bo Xiong in Menghemen Medical Collection of 4 Doctors says, joy injures the heart and it causes yang qi to float and the blood vessels to become too open and dilated. In these cases of sudden joy and excitement, the heart dilates and slows down and the pulse becomes slow and slightly overflowing, but empty. One can understand the effect of sudden joy further if one thinks of situations by excitement of suddenly hearing good news. Another example of joy as a cause of disease is that of sudden laughter triggering a heart attack. This example also confirms the relationship existing between the heart and laughter. One can also understand joy as a cause of disease by observing children. In fact, in children, joy and overexcitement often ends in tears. The best way to understand why joy features in Chinese medicine is in relation to the 3 major Chinese religions, Confucianism, Buddhism, and Taoism. All these 3 religions, or rather philosophies, for different reasons, consider desire and craving as the chief roots of emotional problems. For example, the Taoists shunned social relations and advocated following the Tao. absence of desire or wu yu, and non-action or wu wei. They felt the desire would stop one from following the Tao. The Buddhists considered desire as the root of human suffering. According to them, our very existence begins out of desire and craving when the mind is in the bardo state. The period after death and before the next reincarnation is attracted by the warmth of a womb and it reincarnates. Later in life, desire causes our mind to try to grasp objects like a monkey sways from tree to tree. Finally, Confucianists believe that the true gentleman, a mistranslation of the term Junqi, that actually applies to both men and women, is not steered by emotions because emotions cloud his or her true nature. So to summarize, joy is a normal state. In a normal state of joy is obviously not in itself a cause of disease. What is meant by joy as a cause of disease is obviously not a state of healthy contentment, but one of excessive excitement and craving that can injure the heart. Joy makes the heart larger, and all three major Chinese religions, Confucianism, Buddhism, and Taoism, for different reasons, consider desire and craving included under joy as the chief root of emotional problems. Thank you for your attention.